Welcome to the deep dive. Today we're looking at something, well, really quite fascinating and delicate. The eyes of a newborn foal. Imagine that little foal, just hours old, everything's brand new, especially their vision system. We've gathered insights from some really specialized veterinary sources focused right on equine neonatal eye health. Our mission: to help you understand what's normal, what signals a potential problem, and why catching things early is just so critical for these young horses. You might look at a foal's eyes and think they're just small versions of an adult's, right? Fully functional from the get-go. But it turns out that's not quite the case. They're still developing quite a bit, aren't they?
Oh, absolutely. They are very much a work in progress. It's quite interesting how much maturation happens after birth. For example, right away, many foals have something called legophthalmos.
What's that?
It just means their eyelids don't close completely. There's a little gap, totally normal initially. And you'll often see lower tear production compared to adults, and their pupils look a bit more rounded. And the cornea, that clear front part, isn't as sensitive yet.
Okay, so less sensitive cornea, rounded pupil.
Right. And while the basic pupil response to light, the PLR, should be there from day one.
The pupil shrinking when you shine a light.
Exactly. That should be present, though the response in the other eye might be subtle. But don't expect a menace response straight away.
That's the blink reflex, when something comes towards the eye.
Yes, that takes a week or two typically to develop. So waving a hand towards a brand new foal's eye and seeing no blink isn't necessarily abnormal right then. Other normal things, maybe a grayish iris color, seeing tiny remnants of an old blood vessel, the hyaloid artery, maybe even with a speck of blood for a few hours. And you might notice these lines in the lens, the Y sutures, seem prominent. The optic disc at the back should look round with smooth edges. All normal immature features.
Got it. So things like being a little bit cross-eyed initially, that ventronasal strabismus you mentioned, that can be normal too and just resolves.
Often, yes. Mild strabismus frequently corrects itself as the foal grows and their coordination improves.
Okay, so a lot of these early things are just temporary, part of the package of being a newborn horse. But let's shift gears. What about the things that aren't normal? The problems present right from birth.
Right, those are the congenital ocular abnormalities, issues they're born with. And they really run the gamut from, minor things to conditions that could cause blindness. One of the most common ones we see is entropion.
Entropion.
Yeah.
Sounds like something turning in.
Exactly. The eyelid margin, usually the lower one, rolls inward. So the eyelashes or even hair rub directly on the cornea.
Ouch. That sounds painful.
It is. It causes irritation, definitely. We often see it in breeds like quarter horses, which suggests a genetic component, and things like dehydration, or if the eye seems sunken in ophthalmos, or just the pain itself can make it worse.
So what are the signs we should look for?
You'll likely see excessive tearing. The technical term is epiphora. Squinting, that's blepharospasm. And if it's rubbing enough, you'll see corneal damage.
Like scratches.
Yes, often linear scratches or a sort of bluish haze, which is swelling, edema, or even new blood vessels growing onto the cornea, vascularization. Now, for treatment, this is interesting in foals, often temporary fixes work well. Things like eyelid tacking sutures, just little stitches to pull the lid margin out, or sometimes injections of hyaluronic acid under the skin, or even skin staples can temporarily avert the lid.
So turn it back outwards.
Precisely. And the prognosis is usually good if you catch it and treat it promptly. But here's a key point for foals. Vets generally avoid the permanent surgical fix often used in adults, the hot Celsus procedure, on neonates.
Why is that?
Because many foals actually outgrow entropion as their head shape changes. So you want to manage it temporarily first, give them a chance to grow out of it, rather than doing potentially unnecessary permanent surgery. Untreated, though, it can lead to severe damage, even blindness.
That's a really important distinction. Avoid the permanent fix early on. Okay, what other congenital problems might we see?
Another significant one is congenital cataracts.
Cloudiness in the lens.
Exactly. An opacity or cloudiness in the lens that's there right at birth can be one eye or both, small or large. These are often inherited. We see them in breeds like Appaloosas and Morgans, but they can also stem from infections the mare had during pregnancy or maybe nutritional issues.
The signs are pretty obvious.
Usually, yes. You'll see that white or cloudy spot within the pupil area. If the cataracts are really dense or in both eyes, the foal might seem visually impaired, clumsy, bumping into things. The pupil's response to light might also be reduced.
What's the approach?
Well, if they're small and don't seem to be getting worse, sometimes it's just a matter of monitoring. But for cataracts that are dense and clearly impairing vision, surgery is an option. It's called phycoemulsification.
Like the cataract surgery in people.
Very similar. Using ultrasound to break up and remove that cloudy lens material, it can restore vision.
What's the success rate like?
It varies. For those small, non-progressive ones, the outlook is great. For surgery, it's more guarded. There's a risk of complications afterwards, like inflammation inside the eye, uveitis, or increased eye pressure, glaucoma.
Okay. What else is on the list of congenital issues?
Then there's microphthalmia, which sounds like what it is, an abnormally small eyeball.
Just born with a small eye.
Yes, it's a malformation during development. Sometimes it's hereditary. We see it linked with the leopard coat pattern in apolesis, for instance, and often goes along with night blindness in those cases. You can usually see visually that the eye is smaller. And it often comes with other defects too, like gaps in structures called colobomas or problems with the retina, retinal dysplasia, or even cataracts.
And vision.
Vision impairment is common, unfortunately. And there isn't really an effective treatment to make the eye grow or restore vision. Management is more about protecting the small eye if needed. So the prognosis for vision is generally poor, especially if it's severe.
That's tough. Are there any common congenital things that are less serious?
Yes, definitely. Persistent pupillary membranes, or PPMs.
EPMs.
Yeah, these are just tiny leftover strands from blood vessels that were there in the eye during development. They look like fine, sort of cobweb-like threads floating in the pupil attached to the iris. Most of the time, they're completely harmless, don't affect vision at all, and need no treatment. Excellent prognosis, just an incidental finding.
Okay, that's reassuring. One more.
One more to mention is a corneal dermoid. This is a congenital growth, a bit of tissue that's basically like skin, but it grows on the surface of the eye, the cornea or the conjunctiva.
Skin on the eyeball. Does it have hair?
It often does, yes. Imagine a little raised patch, possibly with hairs growing out of it, right on the clear part of the eye or the pink tissue around it. As you can imagine, that causes irritation, tearing, and can physically block vision depending on its size and location.
Can that be fixed?
Yes, thankfully. Surgical removal, just carefully excising that tissue, is usually curative. So the prognosis is good.
It's really striking how varied these congenital conditions are. You've mentioned breed links for a few, like quarter horses with entropion, Appaloosas, and Morgans with cataracts, Appaloosas with microphthalmia. Are there other strong genetic connections we should be aware of, where specific breeds are really predisposed?
Oh, absolutely. Genetics is a huge factor in equine ophthalmology. It's critical information for breeders especially. For instance, besides Appaloosas, Pasafinos are also known for congenital stationary night blindness. That's an inherited recessive trait. We mentioned Morgans and thoroughbreds for congenital cataracts. That's often an autosomal dominant inheritance pattern. Then there's a whole suite of issues called multiple congenital ocular anomalies syndrome. This is seen in several breeds: Rocky Mountain horses, miniature horses, mountain pleasure horses, Kentucky saddle horses. It's complex.
Wow, a whole syndrome.
Yes. And then you have things like aniridia or iris hypoplasia, basically a missing or underdeveloped iris.
The colored part of the eye.
Right. Sometimes that occurs along with cataracts or dermoids. It's suspected to be inherited in Belgian drafts, thoroughbreds, and quarter horses. Quarter horses are also thought to have an inherited predisposition to optic nerve coloboma, a defect in the optic nerve itself. And thoroughbreds, well, they seem to pop up frequently. They're commonly seen with microphthalmos plus cataracts and entropion, like we discussed. They also get these superficial corneal opacities that often just resolve on their own, and congenital glaucoma.
Glaucoma from birth.
Yes, and standardbreds also show a higher frequency of congenital glaucoma. So yes, breed matters. Knowing the predispositions is really helpful.
That's incredibly useful information, especially for anyone involved in breeding programs.
Yeah.
Okay, so that covers the issues a foal might be born with. What about problems that develop after birth in those crucial first days or weeks? What new challenges can arise?
Right, those are the acquired disorders, and they often come down to, well, trauma, infection, or sometimes underlying systemic illness in the foal. Probably one of the most common and serious acquired problems is a corneal ulcer.
A sore on the cornea.
Essentially, yes. A defect or break in that outer clear layer, the epithelium. Trauma is the #1 cause.
How do they traumatize their eyes?
Oh, lots of ways. They might rub their eye on their leg or on the stall wall. The mare might accidentally bump them with a limb. A piece of straw or bedding could get in the eye. Also, if entropion isn't corrected, that constant rubbing causes an ulcer. Chemical irritation could do it too. And here's a really important point. Downer foals are at super high risk.
The foals that are weak and lying down a lot.
Exactly. Think about it. Their eye might be pressed against the bedding for long periods. If the bedding is soiled, That's a source of bacteria. Plus, just the pressure and friction can cause an ulcer.
Makes sense. What are the signs of an ulcer?
Very similar to entropy and irritation, actually. Squinting, lots of tearing, obvious pain, sensitivity to light. The cornea will likely look hazy or cloudy due to swelling. And if you use a special stain, a fluorescein dye, the ulcerated area will pick up the stain and glow green under a specific light. That's how we confirm and see the extent of it. These can get bad fast.
So, quick treatment is vital. What does that involve?
Definitely. It usually involves frequent topical antibiotics to prevent or treat infection. Topical atropine is often used too.
Atropine. Why is that?
It dilates the pupil, which helps control the painful muscle spasms inside the eye associated with ulcers. But there's a caution with atropine.
Because
It can, in some foals, slow down gut motility and potentially lead to signs of colic, so we have to monitor them closely for that.
good to know. Anything else for ulcers?
Systemic pain relief, usually NSAIDs like Banamine, and sometimes if the ulcer is severe or melting, which means the cornea is literally breaking down rapidly due to enzymes.
Melting. That sounds awful.
It is. It's an emergency. In those cases, we might use topical serum made from the foal's own blood or plasma. These contain anti-enzyme factors that can help start the melting process. Deep ulcers might need surgery, like a graft.
And the prognosis?
For simple, superficial ulcers caught early and treated aggressively, the prognosis is generally good. But for deep ulcers, infected ulcers, or those melting ulcers, the prognosis becomes guarded to poor. They can lead to rupture of the eye or permanent scarring and vision loss.
And you mentioned something critical earlier about steroids.
Yes, absolutely crucial. Never use topical steroids or medications containing steroids on an eye with a corneal ulcer. Steroids suppress the local immune response and healing and can make bacterial or fungal infections much, much worse. They can literally make the ulcer melt faster. Big no-no.
Okay, point taken. No steroids on ulcers. What's another serious acquired condition?
Another major one, especially in very young foals, is ophthalmia neonatorum, also called septic uveitis.
So related to infection.
Exactly. It's inflammation inside the eye, the uveal tract, and it's caused by bacteria spreading through the bloodstream from an infection elsewhere in the foal's body. We call that hematogenous spread.
Where would the infection start?
Common sources are an infected umbilical cord, infection in the gut, or pneumonia in the lungs. Basically, the foal has sepsis, a bloodstream infection, and very often this is linked to failure of passive transfer, FPT.
Meaning the foal didn't get enough colostrum, the mare's first milk.
Precisely. They didn't absorb enough antibodies from the colostrum, leaving them vulnerable to systemic infections which can then spread to the eyes.
What does septic uveitis look like?
It can be subtle at first, maybe just a little redness or cloudiness, but then it progresses. You might see pain, constricted pupil miosis, corneal swelling, or haze. You might even see pus collecting in the bottom of the front chamber of the eye that's called hypopyon, or blood in the same area, hyphema, or just a general hazy look to the fluid inside the eye called flare. It can happen in one or both eyes.
Sounds serious.
It's an absolute emergency because it reflects systemic sepsis, which is life-threatening for the foal, and the eye inflammation itself can rapidly destroy vision.
So how do you treat it?
It requires a two-pronged attack. Aggressive systemic antibiotics, ideally chosen based on blood cultures to fight the sepsis, and intensive topical treatment for the eye inflammation. This usually includes topical anti-inflammatories. Now, here's where steroids might be used topically if there's no corneal ulcer present. If there is an ulcer, we'd use topical NSIs instead.
The ulcer rule again.
Always. And topical atropine again to keep the pupil dilated and reduce pain. Plus, crucially, you have to treat the underlying sepsis and FPT, often with IV fluids, plasma transfusions if needed, and supportive care.
What's the outlook for vision with this?
It's guarded. Even if the foal survives the sepsis, the inflammation can cause permanent damage inside the eye, leading to complications like glaucoma, cataracts, or detachment of the retina. Early and aggressive treatment gives the best chance.
Okay, so ulcers and septic uveitis. What about just plain old injuries?
Yes, traumatic injuries are sadly pretty common. Foals are, well, clumsy in learning coordination.
What kind of injuries?
Kicks from the mare, running into fences or stall doors, falls, getting poked by sharp objects, you name it. Depending on what happened, you could see anything from simple eyelid swelling and bruising to bleeding inside or around the eye, cuts or lacerations on the eyelids or cornea, or even more severe things like the eye actually popping out of the socket proptosis or the globe itself rupturing.
Oh, wow. What's the treatment then?
It really depends on the injury. Lacerations need careful surgical repair. Swelling and bruising might just need supportive care, anti-inflammatories. Proptosis or rupture are surgical emergencies, trying to save the eye if possible, though sometimes removal and nucleation is necessary. The prognosis is highly variable depending entirely on how severe the trauma was.
Gosh, it's clear there are so many things that can go wrong, both from birth and soon after. This really underscores the need for vigilance.
Hmm.
So when a vet suspects a problem, what does the actual examination and diagnostic process involve? It must be tricky with a small, potentially frightened foal.
You're right, it definitely requires a specific approach. Gentle handling and often some patience. A prompt and thorough eye exam is just fundamental. We always start by getting a detailed history. How was the mare's pregnancy? Any issues during foaling? How's the foal been behaving? Eating well? Active? Then the visual exam. We look from a distance first. How does the foal hold its head? Are the eyes symmetrical? Any obvious swelling or discharge? Then we get up close.
What tools do you use?
We'll gently palpate around the eye sockets. A slit lamp is invaluable if available. It's a handheld microscope that gives a magnified view of the cornea, iris, lens. We absolutely use fluorescein stain on every painful or cloudy eye to check for ulcers. Measuring the eye pressure, tonometry is important if we suspect glaucoma or uveitis. And then ophthalmoscopy, using an ophthalmoscope to look deep inside at the lens, the vitreous fluid, the retina, the optic nerve.
Is sedation usually needed for all this?
Often, yes. A little mild sedation can make the whole process much less stressful for the foal and safer for everyone, allowing for a much more complete examination. Trying to wrestle a foal to hold still for an eye exam usually doesn't end well.
Makes sense. What about other tests besides the physical exam?
Lab work can be critical. Blood tests, especially checking the foal's IgG levels, tells us if they got enough antibodies, checking for that failure of passive transfer. A complete blood count, CBC, and chemistry panel can show signs of infection or inflammation systemically. If there's pus-like discharge, or especially if we suspect an infected or melting ulcer, we'll take samples for cytology, looking at the cells under a microscope and microbial culture and sensitivity to find out exactly what bacteria or fungus is involved and what drugs will kill it. And occasionally, for specific things like suspecting a blocked tear duct, nasolacrimal atresia, we might need special imaging like dacryocysterhynography, injecting contrast dye into the tear duct system and taking x-rays to see where the blockage is.
That's a really comprehensive workup. Okay, so once you have a diagnosis, what are the key principles for treatment? You've touched on some specifics, but what's the overall philosophy, especially considering how fragile neonates can be?
That's a great question. The core principles really revolve around a few key things. First, prompt veterinary intervention. Time is often critical. Many of these are emergencies. Second, gentle handling is paramount, as we discussed. Sedation helps here. Third, treatment often involves frequent medications, especially topical ones. Eye drops or ointments might need to be given every 2 to 4 hours initially for severe conditions like ulcers or uveitis. That's intensive. Fourth, systemic medications are often needed too, antibiotics, anti-inflammatories, pain relief. And fifth, never underestimate the importance of excellent nursing care.
Nursing care. What does that entail specifically for eye problems?
Well, especially for those downer foals we talked about, protecting the eyes is critical. Using soft padding around the head, applying lubricating eye ointment very frequently, maybe 4 to 6 times a day, to keep the cornea moist if they're not blinking well. Sometimes a protective eye hood or mask is used. And even for foals hospitalized for other reasons, their eyes should be checked daily for any signs of ulceration because they're just more vulnerable. Good overall nutrition is also vital for healing and immune function.
What about surgery? You mentioned it for a few conditions. Are there special considerations for putting a newborn foal under general anesthesia?
Yes, huge considerations. General anesthesia in neonates is inherently higher risk than in adult horses.
Why that?
Their organ systems, particularly the liver and kidneys, which process drugs, are still immature. They have lower body fat reserves, which can affect how drugs distribute and last. Their small veins can make IV access tricky. They have trouble regulating their body temperature under anesthesia. They're just physiologically different and more fragile.
So surgeons and anesthesiologists need to be really experienced with foals.
Absolutely. It requires specialized protocols and very careful monitoring. Common eye surgeries we might do in foals include those grafts using conjunctiva or amniotic membrane for deep ulcers, those temporary sutures for entropion, again emphasizing temporary, no hot Celsus, cataract removal, phacofragmentation if the eye is otherwise healthy, sometimes surgical implants like valves or laser procedures for glaucoma if medications aren't enough. Repairing eyelid lacerations requires meticulous two-layer closure. Removing dermoids involves procedures like keratectomy or blepharoplasty. We can surgically open blocked tear duct openings, atretic puncta, and sometimes lens removal is needed if the lens luxates or slips out of place.
And you mentioned medication precautions again.
Worth repeating, no topical steroids on ulcers, and always watch foals getting topical atropine for any signs of colic or gut slowdown. Vigilance is key.
It really sounds like a tremendous amount of dedicated, highly specialized care is needed for these little patients. So after all this potentially intensive treatment, what's the bottom line? What's the long-term outlook for vision? And can owners do anything proactively to prevent some of these problems?
Well, the encouraging part is that, yes, many, if not most, of the vision-threatening problems we see in newborn foals can be successfully managed. The key words are accurately and promptly. Early diagnosis and the right treatment plan make a huge difference. However, it's also important to have realistic expectations. Even with successful treatment, some conditions can leave their mark.
Like scarring.
Exactly. Corneal ulcers, even if healed, might leave some scarring which could affect clarity of vision. Foals that have cataract surgery, while they regain functional vision, are left without a lens, making them aphthalmic. Meaning they become very farsighted or hyperopic. They can adapt remarkably well, but their focusing ability is permanently altered.
Okay. What about prevention? Anything owners can do?
Some simple husbandry measures can certainly help reduce risks. Keeping the foaling cell meticulously clean and well ventilated can lower the chances of infectious eye problems or traumatic injuries from foreign bodies. Ensuring the stall is safe, with no sharp projections, is also important. There's also some thought that ensuring the mare has optimal nutrition and health during pregnancy might reduce the risk of some congenital issues, perhaps like retinal dysplasia, but the links aren't always clear-cut. Making sure the foal gets adequate, good quality colostrum promptly is huge for preventing sepsis, which secondarily prevents septic uveitis.
And educating owners seems crucial too.
Absolutely paramount. Owners need to understand that treating these conditions, especially things like ulcers or uveitis, can be a long haul, days to weeks of intensive medication. They need to be prepared for the possibility of surgery. If there's a suspected genetic component, sharing that information honestly is important for future breeding decisions. And owners need to be taught what to watch for even after treatment seems successful in case of recurrence. Observation is key.
We've definitely journeyed through a complex and intricate world today, the world inside a newborn foal's eye. It really drives home how delicate they are, but also how responsive they can be to early, targeted care. It's quite a spectrum, from those normal developmental quirks to potentially blinding emergencies.
It really is. And what I find truly fascinating is the resilience of these young animals. Given the chance with timely, informed intervention, they can overcome significant challenges. Which does make you think, considering how rapidly things change in those first few weeks and how often temporary supportive measures for things like entropion are preferred over immediate surgery. It raises an interesting question, doesn't it? How might our understanding of managing these early life ocular challenges in foals, emphasizing support for natural development, where possible, inform how we approach neonatal care more broadly, perhaps across different species, maybe focusing more on guiding development rather than always jumping to drastic interventions?
That's a really profound thought to leave us with. Thinking about the parallels in neonatal care and development across the animal kingdom, thank you so much for sharing your expertise today. And thank you, our listeners, for joining us on this deep dive into foal eye health. We hope this gives you a clearer picture of what to look for in those precious early days. Until next time.